To today's Way Forward workshop, Leader Lunch Break, where we are pleased to welcome Kirsti Mouncey to the conversation. Kirsti is about to celebrate her second anniversary as president and CEO of the Collaborative to End Human Trafficking. Her personal passion and organizational mission are to eradicate human trafficking through a systemic, community-wide response to this plague. The Collaborative serves as the backbone organization for over 60, yes, 60 different organizations that work in this space. With a social work degree and 15 years of counseling victims and designing programs at the Cleveland Rape Crisis Center, Kirsti brings a compassionate and empathetic lens to her work. Her deep experience and expertise is recognized by the United States Department of Justice, where she serves as a trainer and consultant, and the Mandel School at Case Western Reserve University, where she is an adjunct professor. Her talents in instructing others in the classroom were recognized with the Outstanding Field Instructor Award, and her volume of work led to her induction at Case Western Reserve University, Jack, Joseph, and Morton Mandel School of Applied Sciences Hall of Achievement. She is also the recipient of the National Sexual Violence Resource Center Visionary Voice Award for her tireless efforts to end sexual violence. She is heralded as a tireless advocate for survivors of rape and sexual abuse, and emblematic of her humble nature, she calls herself a trauma-informed servant leader who holds herself accountable daily. Those who know her agree. She's a proud member of the Leadership Cleveland class of 23. Welcome, Kirsti.
Thank you so much. Wow, that was beautiful. Thank you, Marianne. I'm so happy to be here, and I see so many familiar faces. Thank you. Thank you. Thank you for giving up your lunch or joining me while you're eating your lunch on the topic of human trafficking. And thank you to the Leadership Center for picking up such a really important topic that's clearly near and dear to my heart. But may be a little scary to some others. I think that this is one of those topics that can really pierce our souls, and we may often rather want to look away than lean in. So again, thank you all for choosing to share the space with me this afternoon and to get a glimpse of the issue and the depth of human trafficking in our community and the work of the Collaborative, which Marianne already touched upon a little bit. Be aware, though, that once you know about human trafficking, you can't unknow. It's why we have a membership base of now actually over 70 organizations who work with us in this complex issue, trying to solve it. So I will start by telling you a little bit about human trafficking first, because I think it will illuminate why the Collaborative to End Human Trafficking exists and why this is not a social service issue or a police issue, but rather a very complex social problem that requires cross-sector collaboration and multi-system problem-solving power, which is why I think you are all here and why this issue has been picked up. So I want to really dive a little bit into the depth of why this is such a complex social problem and why we're struggling so much with eradicating it. So let's start there. Let me tell you a little bit about what human trafficking is. Many of you may already know, but I never really know. I sometimes walk into rooms where people have some awareness of the issue, sometimes high level of awareness, which makes me obviously very happy. But I always want to level set and make sure that I bring everyone along when I talk about this. So human trafficking at its core is the exploitation of human beings for profit. It mostly takes the form of sex trafficking or labor trafficking. We know a lot more about sex trafficking today than we know about labor trafficking, but both issues are prevalent and comprehensive. A trafficked person is specifically someone who has been recruited, transported, or harbored through force, fraud, or coercion, with, again, the aim of exploiting them for money. We've been giving this language since 2000. A federal law passed, was the Trafficking Victim Protection Act, which really helped us put what we were seeing on the ground into words and really legislated the fact that this was not okay, and we had to do something about human trafficking in our communities. Human trafficking is a billion-dollar industry worldwide. And when I talk about human trafficking, often people tell me that the images it evokes for them are the white van snatching people off the street, people being held, being bound, locked up. There were campaigns, federal campaigns a few years ago where these images were perpetuated. And certainly I always have to throw this in, Liam Neeson did not help us with his many versions of the movie Taken, right? Which just told the story of this girl being kidnapped and this brave father rescuing her over and over again. It is hard to reconcile these images with anything, especially those bound white vans snatched, with anything that could be happening in Cleveland or in Solon or in Independence or Strongsville, name the community that you're in. But the reality is it does happen here. And the reality is that it looks much different from those images that I just described and that we often see in the media. I will tell you, and you may not believe this, but I will tell you today right here that most likely you have interacted with a victim of human trafficking or have been near a trafficking situation. A very recent sting, a sting operation done by our very own Cuyahoga County Human Trafficking Task Force, that is a compilation of various levels of law enforcement, did a sting at a nail salon in Strongsville, at a very well-visited nail salon in Strongsville, at a strip mall that is visited by hundreds of people every week, nestled between a kid's karate studio and an ice cream shop. So see that picture, right? You're in that strip mall in Strongsville. You take your kid to the karate lessons every week. You take them to eat ice cream, and in between is this massage parlor. And all of a sudden, there's this sting, and it's identified as a human trafficking situation. So this happens in our communities. It happens in massage parlors, in nail salons. It happens in hotels, in strip clubs. It happens on the streets. It happens in abandoned homes. It happens in beautiful homes in the suburbs. It happens behind the disguise of webcams and phone apps and computer screens, which is often one of the scariest things, especially for us parents, to think about. Human trafficking takes place in every state. It takes place in every neighborhood, every zip code, and it could look very different in each community, depending on where we go. Maybe by now, like the people in Strongsville did, I get a lot of calls about the Strongsville situation. And the question was, how did this happen? How did I not see this? How did no one else see this? How did we not notice what was going on? And so I want to dive a little deeper to maybe give you this answer. And I think when we look for this answer, we have to take a closer look at who are the people who are trafficked. The survivors we and our partners work with here in Cuyahoga County are mostly born here in our own communities. They're mostly trafficked and bought by individuals who are also born and raised in Northeast Ohio. I know that trafficking often has this notion, traffic, movement, but in fact, what we're finding is that that's not necessarily true. Movement does not necessarily need to happen to coerce and force an individual into this kind of situation. The stories that we often hear from survivors, and I want to mention that the Collaborative to End Human Trafficking has a survivor advisory council that's very important to us. We believe as an organization that we have to listen to survivor voices to better understand how this crime can exist, who is trafficked, what are the dynamics of trafficking. So the stories we hear are often from folks directly who now are advocates in this work and who are advising us in designing programs and developing change efforts. So some of those stories of our advisors are a young woman who was trafficked by her own brother in suburban middle-class hotels, an immigrant father who brought his family here from India to hope for a better life, only to be labor trafficked upon arrival. Another person on our Survivor Advisory Council is a young woman who was sold into marriage while she was still underage and exploited for many years by her husband. Let me give you some more statistics to help dig deeper into who these victims are. In Ohio, on average, victims of human trafficking are between 12 and 30 years old when they're identified. 85.5% of victims in Ohio are minors. 1 in 5 homeless youth are victims of human trafficking. This includes 17% who have engaged in the sex trade to survive. 60% of child sex trafficking victims have been within foster care. 39% of youth sex trafficking victims are identified as LGBTQ. 56% of transgender youth reported being involved in the sex trade in some way. 40% of sex trafficking victims were identified as Black women. The previous victimizations through sexual assault and other traumas are even more staggering. So you're picking up on what I'm talking about. Some people in groups experience trafficking at a disproportionately higher rate, and data shows repeatedly that the majority of trafficking victims identified in the United States are people of color, Indigenous women, immigrants, documented and undocumented, people who identify as LGBTQ+, and females. Herein lies their vulnerabilities. These inequities, which foster vulnerabilities to trafficking, are concentrated in some communities and populations, such as communities that have historically faced discrimination and political, social, and economic consequences. People living in poverty are vulnerable because of simple economic needs that are often exploited. Those who have grown up or are living in foster care often dealt with trauma, abuse, and instability that leaves them vulnerable to emotional manipulation, which is what traffickers use to bound their victims to them. It's not physical, it is that emotional trauma, that connection, that emotional abuse. When you haven't had emotional needs met in childhood primarily, traffickers will manipulate and void for that benefit. Childhood sexual abuse is a breeding ground for traffickers, and it teaches you to not recognize your body, not own your body, and no does not mean no. Also, I want to talk a little bit about people struggling with addiction. They can either be lured into trafficking by drugs and alcohol, or often alcohols and drugs are introduced as another way to bind victims to a trafficker. Basic physical needs like unstable housing or food insecurities can create openings for traffickers. So those are many, many examples of vulnerabilities and who victims of trafficking are. And herein lies the work of the collaborative and a need for collective impact to solve and combat the issue. If victims are invisible in our society, which I hope I painted that picture, that these are often invisible victims in our society and community, it is up to us as systems and institutions and organizations to help make them visible and disrupt the crime. Victims of trafficking do not self-identify, or very rarely self-identify as such. So we have huge opportunities in our systems to make that identification happen and create a path of recovery for these individuals. I'll give you an example that I will never forget. We work very closely with our sexual assault nurse examiners at UH. And Kathy Hackett, who's a huge advocate for this issue as well, always says, I'm so glad I got the education from the collaborative to know how to identify a victim, because I can think of many survivors I missed because I did not have that information. Also, a recent study done by Polaris, which is a national think tank on this issue and provides us with lots and lots of statistics. Just recently, they just published a report that identified all the places that trafficking victims interact with while in the trafficking life. So think about it. They're in the life of trafficking. They still go grocery shopping. They still go to school. They still go to the doctor. They still interact with their financial institution, right? So those were actually some of the top institutions that victims interact with while in the life. Number one were financial institutions. So if you're on this call today from a financial institution, let's talk. How can financial institution and anti-human trafficking organizations work together to identify patterns of trafficking and to help identify victims? Taking someone's credit, right? Erasing their credit, taking their financial assets from them is another way to bind them to a trafficker. So there are lots of opportunities to interrupt. It takes education and awareness, which is what we're doing today, and systems and organizations and joint efforts to change behaviors and break down silos that create a safe path for survivors to walk into freedom. I learned in my leadership class just a few months ago that systems are designed to achieve exactly the results that they're designed to achieve, right? We all learned that and know that. Unfortunately, what we're learning here, and hopefully I'm illuminating in this conversation, that these systems that we've designed often miss victims of human trafficking. So the Collaborative to End Human Trafficking is here to lead, empower, and connect our community to eradicate this issue. The way we do that is by providing leadership and expertise to empower a systemic community-wide response to human trafficking. And we do that by equipping organizations and individuals with knowledge, with tools, with resources to address human trafficking within their own systemic silos. And then we built this table of 60, 70 organizations, hopefully many more that will come together, that create a think tank to help us understand how we can work together and how we can do this work better and prevent this issue from happening in the first place. So I'm sure I already see some questions coming through, but that's in a nutshell what I wanted to share with you. When I give presentations, one of the things I always like people to do when they walk away from the conversation, one, hopefully get more curious about this issue. One thing I always ask people to do is share one thing you learned with another person today. And the other ask I always leave people with is open up your spaces to help us create more awareness and education. So if there's anyone you know who could think, you can think of who can benefit from bringing us in, learn about this issue, connect, be part of our coalition, we would love to take you up on that.
Kirsti, thank you so much for providing such great insights. And I think, as you mentioned, so many of us probably have come across a situation
Yes.
of human trafficking. Can you share what might be some of the signs to look for? And if we recognize that type of situation, what do we do?
Yes, that's a very good question, and one we get a lot. And unfortunately, there's no one specific answer. But some of the things that we can look out for are power dynamics, for example. So I'll go back to the Strongsville example of the nail salon. So I wonder if people noticed women being brought in a car every morning, walking into that massage parlor, in this nail salon, never leaving during the day, and then being picked up again in the afternoon. I wonder if people walked into that nail salon and these women weren't open and free to talk to customers. And there was always someone there who watched them, observed them, and interrupted at any point. So really watching out for those kind of power dynamics. What's happening to people? What are we noticing that might be off and that might lead me to think that there's something happening? Two things that people can do: they can call us for more information, to talk it through, to consult with us. Also, our Human Trafficking Task Force is a great resource, and I can certainly send that info to Marianne and you, Rachel. But they're really there to look at every kind of situation that's suspicious, and they will follow every lead and are trained by us. So they're very victim-centered and trauma-informed in their work.
What local resources are available for those who have been brought out of a human trafficking situation?
There are a lot of local resources that we have available. I want to add that there is not one organization that is solely focused with wraparound services for human trafficking victims, which again, this collaboration, that working together, having really good communication over survivor cases that are shared, that you know, having MOUs in place and all of that is really important. So if you go on our website, we actually have, it's www.collab2endht.org. We have a resource guide that we compiled over the years that has all of our coalition partners who are doing this work, as well as other resources. So there's lots of organizations who have come along, who are screening for trafficking, who are training on trafficking, and who are really trying to change behaviors within their systems to better serve the needs of victims.
How does the incidence of trafficking in Greater Cleveland, Northeast Ohio compare with other Great Lakes cities?
That's a really good question that we get a lot, and I'm always very hesitant to give statistics, and that's another reason why we need to come together and really create a collective impact approach for data collection. Currently, there is not a good unified data collection mechanism. So we have our task force collecting data, we have our hospitals collecting data, we have our service providers collecting data, but we're not de-identifying, we're not making sure that there is you know, overlap. So I'm very, very hesitant to share any of that data with you, because I don't think it adequately reflects the picture. I do want to mention that this is an issue we're wrestling with statewide as well as nationally. Our Ohio Attorney General is working on that from a statewide level. I'm on a task force to help think through that on a statewide level, which then I'm certainly hoping to bring to the local level to also implement. But it will take some time to really get that good data.
So over the past few years, there's been some national level stories like a Jeff Epstein that maybe have impacted the awareness around human trafficking. What kind of impacts of awareness are you seeing? How can work continue to be done to elevate this issue among communities?
What's been certainly good in elevating the issue is taking these examples, these very public examples, and taking them apart and see, you know, how do these dynamics of trafficking look? Who are the traffickers? In this case, a very powerful person. You see the dynamics. You saw, you know, those vulnerable victims that he exploited, and you also saw who sort of the middleman was. And in his case, we know that was a woman who ultimately got, you know, has taken the brunt for this crime. So it is really helpful. It does shine a light on this issue, but it in some ways also dilutes the message, because these cases do look very different from what we often see on the ground. But we love it. It's a great conversation starter and a great way to shine a light on trafficking, that it really does happen, and that it happens in the shadows, and you know, who the victims are.
How have the past few years of the pandemic impacted human trafficking? Are potential increases harder to identify?
Yes, actually, we just had our trafficking in-person report released. It's a report that the national government, the federal government releases every year. And they've clearly identified pattern of increase of human trafficking. Scarily, the online exploitation has increased significantly. They cited a 22% increase in online exploitation, directly relating it to children being isolated, children being much more on their computers, being at home and disconnected from social networks. What we're also seeing is that resources were taken away from anti-human trafficking efforts, really pushed more towards basic needs. So we're regaining some of that momentum and are advocating for some of those resources again. It also has really disrupted our coordinated response system that we have built in Cuyahoga County. So the nurses and the police officers and the social services working together to create that safety net has really been despaired. So we're again working very hard on putting that back together and looking at, how can we make that stronger so something like a pandemic will not allow it from disrupting again.
You mentioned the increase in online exploitation. What might the signs of that be, and what should parents, individuals look for, especially when looking at their children being online for so often these days?
Yeah. I mean, we recommend very much that parents should be in touch with their children about what online activities they participate in. It really goes back to a trusting relationship with your children, knowing who they're talking to, knowing what actions to take, watching for behavior changes, watching for any potential things that they bring into the house. One things that we see is that traffickers often reward their victims by giving them shoes, getting their hair done, clothing. So again, it's being very keen, knowing your child, recognizing any kind of potential changes, may that be physical, emotional, if they're already in a situation like that. But certainly being really aware and being really nosy about what they're doing online.
So as you think about the work that the collaborative is doing, what do you identify as your greatest challenge, and how are you all working to address that?
I think our greatest challenge in the collaboration and coalition space is that our partners are, as I said, no one's focused on human trafficking 100%. So we get people's attention on that 10% when we bring them to the table and we talk about what we can do different. So definitely getting attention, getting into spaces, getting leadership awareness from institution. We often get folks who are really dedicated that are nurses and police officers, but they don't have maybe the institutional buy-in to really support that work and to truly push through any kind of changes that the organization can do. So that is something that we work very hard on, again, is creating that awareness, talking to industries and organizations specifically, and trying to help them understand what role they can play and how important their role is in getting involved.
And as you look ahead, what is your vision for the collaborative over the next 5 or so years?
Some of our strategic aspirations at the collaborative is one, to significantly expand the role of survivors in this space. As I said, we have 10 survivors who are currently survivor advisors. We believe that that is the future in really identifying how that crime works, how it moves, and how we can help getting people out of the life. We also have a huge focus on prevention. We are having a lot of conversation locally and statewide on how we can address these vulnerabilities, how we can work systematically with our child welfare system, with the mental health system, with the substance abuse system, with the housing system. How can we come together as systems, knowing that these vulnerabilities create challenges for all of us? How can we come together and, again, collectively address these vulnerabilities earlier? How far upstream can we go to make sure that kids are not turned into victims very early? So those are probably two of the biggest priorities. Also, we're always obviously increasing our coalition base. We want many organizations, systems, and businesses to participate and to help be a part of the solution.
So Kirsti, this is obviously a space that can be very heavy and very challenging.
Yes.
But as you look at our community, what brings you hope?
What brings me hope? I think it's, again, I go back to the people that have survived, who are here to tell the story and are thriving in after having lived through this experience. I'm also very hopeful by people like all of you today coming on this call and listening about human trafficking and its complexities. There are amazing people in our communities, people who are ready to roll up their sleeves and to do this work and connect. So that what gives me hope. There's always forward movement.
Well, Kirsti, we thank you so much for sharing all of your insights around this incredibly challenging topic and such an important topic for everyone to be aware of. And I will be sure to share the website with everyone for follow-up.
Yes.
And we encourage you to go to the website, learn more, find the resources, and reach out with any additional questions.
Great. Thanks so much, Kirsti. We really appreciate all the incredibly helpful information you shared with all of us to generate more awareness about this plague. We appreciate it.